I am Dr. VenuMadhav, consultant orthopedician in Mallareddy Narayana Hospital. I am orthopedic consultant plus arthroscopic specialist dealing with sports injuries in this hospital. So, sports injuries are commonly seen in people, in young adults and adolescent people from the age of 12 to 26 years. So, earlier also in earlier group also we can see sports injuries, but the most common age is from 13 to 14 years to 26 to 30 years. So, what are the most common joints involved in the sports injuries are, this is called knee joint. Knee joint is the most common joint involved in sports. The second joint is the shoulder joint. Okay. In the knee joint, the most common joint, normal anatomy is, we see two ligaments here. This is called the medial collateral, this is the lateral collateral. Inside we see meniscus, this is the washer or cushion between the two bones, and from back we can see two ligaments, ACL and PCL ligaments. So, the most common ligament to be injured is the ACL ligament, and the second most common ligament to be injured is the PCL. And these other injuries are the meniscal injuries, are like the medial meniscus, lateral meniscal injuries, and patellar injuries and fat pad injuries and patellar tendon injuries. These are the common knee injuries. They can be single ligament or they can be multiple ligaments. And the most common treatment for this is arthroscopy. Arthroscopy is keyhole surgery involving two small holes, one in the medial side and one in the lateral side, where you go into with the camera, you keep a hole, put a camera and see the joint from an arthroscope, and through the other hole we can do the meniscal repairs or meniscal removal, or even if there is a ligament repair, we can do it one hole, or we can reconstruct the ligaments using the new tendons. All can be done through arthroscopy. It's keyhole surgery. The second most common joint involved is the shoulder joint. In the shoulder joint, the common injury is recurrent dislocation, where the shoulder dislocates from the scapula recurrent. Recurrent means more than 2-3 times. So, usually occurs in bowlers, swimmers and all. So, where in recurrent dislocation, even if you reduce the joint, the chances of recurrent dislocation increases with each dislocation. So, the common injury is the labral, means here the tissue, this is the scapula, this is the tissue, this is called labrum, where this tissue comes out of the bone, and this humeral head comes into this place and causes dislocation. So, what we do is, through a hole, a small hole from the back side and two small holes from the front side, we will repair the labrum and we will reattach it to the scapula. So, this is called Bankhart's repair. So, we will do it through arthroscopically. The second common injury is the rotator cuff injury. Rotator cuff is a supraspinatus muscle. There are three muscles here: supraspinatus, subscapularis, and back is the infraspinatus. So, in heavy sports and where there is a recurrent exertion, there are a sudden fall while playing sports, these tendons are prone to tear. The most common tendon to tear is the supraspinatus, second most is subscap and infraspinatus. Even these tears can be repaired through arthroscopically, like we can keep a small hole in this place, we will visualize it, everything through the camera, we will clean it and reattach this muscle again back to the bone. This is called as arthroscopic supraspinatus repair or rotator cuff repair. This is the second most common. The other things are the cartilage repairs or the biceps tendon repairs, which biceps tendon tear, which also can be treated through a keyhole surgery, that is arthroscopy.